Okay, so this is the lecture number 7 regarding the thrombosis and the shock. Okay, after this lecture, I expect you people to define the hemostasis, which is a normal event. Then you should define the thrombosis, embolism, and infarction, and various mechanism involved in it, and morphological appearance of thrombosis and infarction and its types, and the mechanism of shock. Okay, all are very important. Okay, so let's go to the chapter of hemostasis and thrombosis. Very simple. Okay, and you all know this, just I am going to extract from you people. What is this? Blood vessel and the endothelial cells. You all know endothelial cell sits on the basement membrane. Endothelial cell sits on the basement membrane, right? Okay, so and this is the endothelial cell. Okay, now inside the blood vessel, the blood is fluid or solid? Blood is fluid. The blood is fluid. For example, if the person got a cut here, okay, the person got a cut here, the blood vessel is damaged, what will happen? What will happen to the blood? What will happen? The blood will come out, right? The blood will hemorrhage, bleeding. The blood will come out. After that, what will happen? Afterwards, they will clot, right? They will clot. Okay. So, if the blood vessel is good, the blood will be inside in a fluid state. If the blood vessel is damaged, the blood will clot. Actually, if you ask even a 5-year-old, I mean 5th studying student, they will tell this, right? So this is hemostasis. This is hemostasis. So hemostasis means the blood in a fluid state if the blood vessel is normal. If the blood vessels are damaged, the blood has to clot, which means the blood has two properties: to be in a fluid state, to get clot. Understand? So this is hemostasis. This is hemostasis. Okay, now we will take another example. Yeah, it starts from inside. So now this is the normal blood vessel type, and the blood endothelial cell sits on the basement membrane. Okay. Now there is no injury. There is no injury. Blood vessel is normal. If it clots, what is that? What is that? It is good. It is normal or abnormal? Abnormal. So this is thrombosis. This is thrombosis. Understand? So this is hemostasis. This is thrombosis. Understand? In pathology, the blood clot is called hemostatic plug. It is called hemostatic plug. So hemostasis means blood in a fluid state, that is clot free state in normal vessels. But when there is a vascular injury, it induces rapid formation of localized hemostatic plug, nothing but clot. Okay, so that is the definition for hemostasis. Okay, pathological form of hemostasis is thrombosis. It involves blood clot, that is thrombus formation in uninjured vessel. The vessel is normal, is normal, uninjured vessel, and or very minor injury. Okay, for minor injury and all, the blood will not clot. Okay, so for very minor injury. So the hemostasis and thrombosis involve vessel wall. This is the vessel wall and platelets and coagulation protein in the blood. So three things are involved: vascular wall, platelets, and coagulation cascade. Minor injury, that's what I told. Minor injury, there will not be clotting unless until all the walls are damaged. Okay. That means complete blood vessel wall is damaged, then there will be a bleeding. Okay, if only one layer is damaged, there will not be a bleeding. Okay, so there will not be a clot formation. Now coming to the vascular injury, once the blood vessel is damaged, immediately endothelial cells secrete endothelin. Endothelial cells secrete endothelin, and that will cause vasoconstriction. That is the first step. That will cause vasoconstriction. After that, see, now this is the blood vessel which is damaged, So this is the endothelium and this is basement membrane. Understand? It is basement membrane. Once the basement membrane is exposed, the basement membrane has special factor, special protein called von Willebrand factor. This is very, very important. So once there is a damage to the blood vessel, the platelet, if they see the von Willebrand factor, they attach. And once this platelet get attached, they invite all the platelets. And all the platelets will join. And they form first clot. That is called primary hemostatic plug. That is due to platelet. Understand? So that clot is very weak. Okay. Once this happens, in the plasma we have proteins, right? The proteins, what are they? Albumin, globulin and coagulation proteins, clotting proteins. So once the clotting protein saw the platelet, once the clotting protein sees the platelet clot, this clotting protein will become active. It gets activated. When they touch the platelet, they become activated. Once they become activated, they act like a cement. They go inside the gap and they form a cement-like structures and they form a clot. That clot is secondary hemostatic plug. This is very strong clot. Understand? So this is due to what? Coagulation protein. So after the platelet clot, the coagulation cascade, because there are many proteins, coagulation proteins, one gets activated, other will get activated. Understand? It's a chain of events. There are, if for example one protein is get activated, that will activate another protein. Then that will activate the another protein. Likewise, it's a chain of event, and then they form the secondary hemostatic plug. It acts like a cement. Okay, so this is the mechanism of clotting formation. Very simple way I am telling. Okay, it's actually there are many mechanisms involved. So it is a very simple way of understanding the mechanism of clotting formation. Here I am telling about two things: primary hemostatic plug, secondary hemostatic plug. Primary hemostatic plug is due to what? Platelet. Secondary hemostatic plug is due to what? Coagulation protein. If the person is having coagulation protein deficiency, which is affected? Secondary platelet plug is affected. So if they have platelet deficiency, primary hemostatic plug is affected. Yeah, so that is the problem. When the platelet is less, it will indirectly affect the secondary hemostatic plug. Okay, now coming to the thrombosis. So thrombosis to happen, there should be three reasons. One is, that is called Virchow's triad. There should be endothelial injury, okay, and there should be a stasis of blood. That's why in a person, the blood should not stay in a place for more time. Understand? So turbulence of blood. Okay, the blood should not travel very fast. And if they have a hypercoagulability nature, always their clotting factor is in active stage. Always they have a active clotting factor. Okay, endothelial injury, example hypertension. For example, if the person is having more pressure in the blood, that can damage the endothelium. Endothelium. Because endothelium are very delicate cells. If the endothelium is damaged, what will happen? No, endothelium is damaged, the basement membrane is exposed, subendothelial area is exposed. So subendothelial area, what we have? Von Willebrand factor. Okay, immediately platelet go and attach. Understand? Immediately platelet go and attach. So hypertension or inflammation will damage the endothelial cells. Okay, now abnormal blood flow. For example, the blood is staying for longer period in the veins. Okay, what will happen? The blood cells will settle, and the platelet clot is formed. Or the person is having fat in the blood vessel, that is called atheroma. That will narrow the blood vessel. When the blood vessel is narrowed, this area the blood will go fast or slow? It will go, see, it will, when you close the half of the pipe, the water comes very fast, like so the blood flow will be very fast. When the blood flow is fast, it will damage the endothelium. So when there is stasis, the laminar flow is affected. When there is fast blood flow, that is turbulence blood flow, then the endothelial cell is affected. So that will lead to clot formation, thrombus formation. And if there is hypercoagulability of blood, hypercoagulability means it may be due to primary reason that there is a factor 5 mutation where it happens to make the active factors, they form the active factors. Or secondary reason, bed rest, tissue damage, or in cancer. You all know clotting factors, all the clotting factors name. You know extrinsic and intrinsic pathway in clotting mechanism? Extrinsic and intrinsic mechanism, common pathway? No, okay. So see, there are three mechanisms involved in clotting factors activation. One is extrinsic mechanism, intrinsic mechanism, and all will join in a common mechanism. Okay, so extrinsic mechanism gets activated when there is tissue damage. When there is tissue damage, that releases tissue thromboplastin. Okay, see, there are clotting factors. Please try to, again, if I go into that basic, it will take 2 hours. So any fibrinogen, thrombin, and fibrinogen, prothrombin, tissue thromboplastin, calcium, Labelle factor, unknown factor, stable factor, hemophilia A factor. You all know this. Okay, so there are many factors. Okay, so make it simple, big story. So there are many factors. So one of the factor is tissue thromboplastin. This comes out of the tissue when the tissue is damaged. If there is a burn injury, that comes more. If there is any cut, that comes more. Or I got crushed, the tissue thromboplastin factor comes more. Or the person is pregnant, she is delivering. In some women, they go for immediately clot formation all over the body during delivery. Understand why? When during delivery, this thromboplastin is released more. Okay, that will induce clot formation. So this tissue thromboplastin is increased when the person is taking bed rest, when the person is having cancer, or if the person is having tissue damage. These are all very important. That's why we will not make them to go for bed rest. The physiotherapist will keep on doing something on that patient. Understand? Okay, now once the thrombus is formed, once the clot is formed, the clot will move towards the heart. The clot will grow towards the heart. Okay, so that is called propagation. Or our body mechanism can break the clot, can completely break the clot if they have very good mechanism, anti-clot mechanism. That is called resolution. This is very, very important. If the clot, for example, there is a clot formation in the legs. For example, a person got accident. Okay, if you see any person got accident, they will take a bed rest. Or they got fracture, they have to stay in the bed for longer period. When they stay in the blood, do you think that why the blood is coming to the heart again? See, you are standing, right? It has to go against the gravity when they have to come to the heart. One of the reason is the veins has valves that pushes the blood. Another reason, what is called heart of the muscle in our body, it is called like a heart. What is that? You know calf muscle? Calf muscle acts like a heart. It pumps the blood when you move. That's why a person cannot sleep for longer period. They keep on moving. Why? The calf muscle has to pump so the blood goes back to the heart. Understand? So calf muscle also act as a heart. Okay, when the person is taking long bed rest, what happens? The blood stays in the leg side. The blood stays in the leg side. We all know the blood should not stay. If it stays, it settles. Right? If it settles, it forms a clot. Now there is clot formed in the legs. The clot is formed in the leg. That is thrombosis. It's abnormal. It's a thrombosis. If it gets break, then it travels. It travels in the vein. The veins goes where? To the heart. The heart, from the heart it goes where? Lung. So lung capillaries are small. So it blocks the lung capillaries. Understand? So the clot is somewhere, but the thrombi is blocking somewhere. Understand? So it is called embolism. It is called embolism. That is the next thing we are going to discuss. Okay, at least you should know these three things, very important. The clot can propagate, can grow towards the heart, or it can embolize, or it can resolute. So what is embolism? Embolism is any detached solid, liquid or gaseous mass carried by the blood to its distant site from its origin. Okay. For example, I told in the deep vein of leg there is a thrombosis. It gets break and it goes to the lung. So that is embolism. So there are most commonest embolism is from the thrombus, and the pulmonary emboli means the thrombus is formed in the deep vein and it is affecting the lung. It is affecting the lung. Systemic emboli means the thrombi is formed in the heart and it is getting break and it is going into the systemic circulation. If the thrombi is formed in the heart, cardiac mural. What do you mean by mural? You have heard of mural in medical terminology. Mural means wall. Okay, mural means wall. So if there is any thrombi in the heart wall, then the thrombi gets break and it enters the aorta. Then it goes to the systemic circulation. So it is called systemic emboli. If the thrombi is formed in the systemic circulation, if it gets break, it goes to the lung. It is called pulmonary emboli. Okay, there are other types of embolism. The person getting accident, when the long bone is, you all know long bone? Okay, for example leg bone, if it gets fractured, inside the bone we have marrow. Marrow has fat. That fat can enter the circulation, it can block the lung, it can block the pulmonary vessels. So that is called fat embolism. You know scuba diving, the person goes deep to the sea and when they are coming back, if you notice, they will come very slow. Why? If they come fast, the nitrogen bubbles are formed in the blood. That will block the lung. So that is called air embolism. And during it's a very rare event, sometimes happens in the child. So during the delivery of the child, that baby can get amniotic fluid from the mother into the circulation. You know amniotic fluid? That from the mother it goes into the circulation of the baby and it will obstruct the lung of the baby. Immediately after delivery the child will die. Immediately after delivery the child will die. So it is called amniotic fluid embolism. Okay. Now it is very easy, you know this, just I am going to give the name. See, this is blood vessel. If it is blocked, what will happen? Okay, thrombosis is making block. What will happen after the block? The blood flow is normal or less? There is loss of blood flow, right? So that is called what? Ischemia. Ischemia creates what? Hypoxia create what? What is cell injury? Necrosis. Okay. So block in the blood vessel creating ischemia. Ischemia causing hypoxia. Hypoxia results in necrosis. Okay. This is called infarction. This is called infarction. A ischemic necrosis. Okay. By the occlusion of the arterial supply. 99% of the infarct are due to thrombotic or embolic event. Thrombotic or embolic event. In other words, major cause of death is due to thrombotic and embolic event in the world. Major cause of death is due to this. So when we see the infarct, we look into the color of the infarct. If it is red color, we call red infarct. If it is white color, we call white infarct. So especially in the lung, you see red infarct. In the heart, spleen, kidney, you see white infarct. Because in the lung, the occlusion is on the venous side and it is loose tissue and they have dual circulation. Whereas white infarct, the occlusion is on the arterial occlusion and it is solid organ. If you take a lung, if you put it in the water, it will float. If you take a heart and put it in the water, it will sink. So heart is a solid organ than the lung. So this is a lung infarct. It is red color, right? And you can see the splenic infarct, it is white in color. And remember, all the infarct are wedge shaped. See, this is the wedge shape. So the blood vessel get blocked here. So that's why this area going for infarction. Understand? It's a wedge shape. Wedge shape means like this. And infarction will produce coagulative necrosis. Infarction is a coagulative necrosis. So now coming to the shock. This is the last 2-3 slides is left. And please carefully see, because this is the best concept to discuss in the last, because I am going to bring all the concepts here. What are the things we discussed so far from cellular injury? See, this is a blood vessel, right? And the person is having, okay, let's go from the heart. For example, this is the heart, this is the left ventricle, and this is the systemic circulation, and this systemic circulation goes, for example, to the kidney. Okay. Now, carefully see, the person is having problem in the left ventricle. The blood will come out normal or less? Sure. When there is problem in the left ventricle cannot work normally. What is the work of the heart? To contract. They cannot work normally. When they cannot work normally, the blood can come out normal or less? Less. So the blood is coming out of the heart is called cardiac output. It is called cardiac output. Okay. The cardiac output will be normal or less? Less. When the cardiac output is less, okay, now let's draw here. This is heart and this is systemic circulation. This is kidney, for example, and now the heart is not functioning. They are having some problem here. So the cardiac output will be less. So that will, when the cardiac output is less, the blood volume is less, right? The blood volume is coming out is less. When the blood volume is less, the pressure will be less or more? Less. Any doubt? Okay, the pressure is less. When the pressure is less, we call as hypotension. We call as hypotension. When the pressure is less, do you think that blood can go to all the organs? Okay, so that will cause less perfusion. Understand? That will cause hypoperfusion. See, first is hypotension, then hypoperfusion. Okay, when the less blood is going to the any organ, they will get good oxygen or less oxygen? So they will have hypoxia. Okay, when they have hypoxia, what will happen? Necrosis. Okay, but it is happening due to what? Less heart function, right? So it is going to affect all the body. So all the organ goes for necrosis. All the organ goes for necrosis. Understand? They go for multi-organ failure. So that is called shock. That is called shock. Understand? So there is systemic hypoperfusion, and it can be due to reduced cardiac output. It can be due to reduced cardiac output. Okay, now I'll give another example. There is a heart and it is a systemic circulation. I'm taking a kidney as an example, and venous return comes, right? Blood comes from the venous side. This is called venous return. This is called cardiac output. Okay, now the person got accident. Okay, now all the blood is lost. Okay, the person lost too much of blood. What will happen to the blood volume? Decreased. Okay, when the blood volume is decreased, when the blood returning to the heart will be less or normal? Less. When the heart returning the blood less, getting the less blood, output will be less or more? Less. When the output is less, the volume will be less or more? Less. When the volume is less, the pressure will be less. When the pressure is less, oxygen going, tissue gets the less blood or more blood? Less blood. That is hypoperfusion, and that will have leads to hypoxia. Understand? So loss of blood causes hypovolemia. Hypovolemia causes hypotension. Hypotension causes hypoperfusion. Hypoperfusion causes hypoxia, and again multi-organ failure. Again multi-organ failure. Okay, I'll give one more example. The person is having a heart and he is having a kidney. The person is having severe infection, he's got lot of diarrhea and vomiting. What will happen to his blood volume? Decrease, because fluid is going out, so it is decreased. So he will have less volume, less pressure, less perfusion, less oxygen, ends up with multi-organ failure. Understand? So whether either it is due to reduced cardiac output or reduced circulating blood volume, it results in hypoperfusion. Hypoperfusion leads to hypotension, and hypoperfusion, that is impaired tissue perfusion, and hypoxia. This is the result. This is the result, and the whole organ, the multiple organ goes for failure. That is called shock. That is called shock. Okay, so there are five types of shock, and we are going to see mainly three types. The rest of the things we will see in the other module, these two. Now cardiogenic shock means what? Heart is not functioning properly. One of the most commonest reason is myocardial infarction. What do you mean by myocardial infarction? Heart is dying, right? Necrosis. Due to why? Due to ischemia to the heart. Ischemia to the heart. Okay. Now hypovolemia, the reduced blood volume. Reason is hemorrhage. Hemorrhage means bleeding. Diarrhea. Burns. Burns, what happens is the blood volume is shifted to the interstitium because of endothelial injury. Understand? So septic, in severe infection. Severe infection will also produce the same thing, but I am going to discuss little bit more here. And you all know this. What is this? This is endothelium. Now there is severe infection, full of bacteria in the blood. Okay, he is a diabetic patient, full of bacteria in the blood. What will happen? See, what all the things which I taught so far, from that you think. Okay, don't think from outside. Okay, what are things I told you so far from the beginning when you saw me till now? Okay, from that you think. Okay, what will happen if there is bacteria in the blood? It will, yeah, mashallah, it will trigger inflammation. First it will trigger acute inflammation. What is the chemical mediator, cytokines involved in acute inflammation? Then TNF, IL1. TNF, IL1 will be more, right? TNF, IL1 will be more. And you all know this will go to the neutrophil and increase the phospholipase. Now that is one side. Another side is they will directly damage the endothelium. They will directly damage the endothelium. When the endothelium is damaged, the basement membrane is exposed. Basement membrane is exposed. Von Willebrand factor is exposed. What will happen? Platelet clot is formed. Platelet clot is formed. And secondary clot is formed, right? Okay. Now endothelium is damaged, right? Now what will happen to the fluid? The fluid goes out, right? Edema is formed. Edema is formed. Okay. Now this is the endothelial cells. because of TNF and interleukin 1 increased, that damage the endothelial cells, and one basement membrane is exposed, 1 Willebrand factor is exposed, platelet clot and the secondary clot is formed. Because of endothelial damage, and if more fluid goes out and they form edema. Understand? They form edema. So when there is clot is formed, this is happening all over the body. This is happening all the capillaries. This is happening complete capillaries in the body, because the bacteria is in the blood. Okay, the bacteria is more in the blood. Okay, now the clot is formed, right? See, when you close the halfway of the pipe, the flow will be more or less? More. Now the flow is more. Do you know the clot is a sticky one? When you get a cut in your hand, if you see the clot is formed, right? That clot, if you touch, it will be very sticky. Okay, so when it is sticky, the RBCs attach. RBCs get attached. Red blood cells get attached. But the flow is very fast, right? They will pull the RBC. And the RBC gets break. Now RBCs are reduced. Okay. Once again I am telling, TNF and IL-1 is increased. That will damage the endothelial cell. That is the single damage. It is resulting in this. When the endothelial is damaged, fluid goes out. Edema is formed. When edema is forming, blood volume is reduced. Okay, and blood is going very slow and the clot is forming and RBCs gets break. RBC is reduced. Okay, so oxygen carrying capacity is reduced. And there is a blood volume is reduced because of this edema. Okay, now the clot is forming, right? Okay, now in this patient, if you take his blood and if you check his platelet, if you check his clotting factor, it will be high or less. Why high? See, now all over the body in the capillaries, the small clots are forming. Okay, clot formation means they are using the platelet and they are using the clotting factor. Okay, now my question is, in this patient, if you check the platelet and the clotting factor, it will be normal, high or reduced? Reduced. Why it is reduced? Because? Okay, mashallah. So this is called consumption coagulopathy, because it has been more used. Okay, it has been utilized. When you utilize more, they cannot immediately produce. Okay, so that will be leads to decreased platelet, decreased clotting factor. So what are the things happens here? Okay, in septic shock, what are the things happens? Decreased platelet, decreased clotting factor, and RBCs are broken down, decreased RBCs, and the blood volume is reduced. Okay, this all will create hypotension, and because of RBCs reduced, they will produce severe hypoxia. And one more thing they will do, this clotting is forming all over the body, right? Because of that, platelet and clotting factor are reduced and the patient have a tendency to bleed more. So they have bleeding. Understand? Because clotting factor, see, that's what, this is a very different thing in other mechanism than this. Because in septic shock, actually inside the clot is forming, but because more clots and clotting factors and platelets are used, so if they have a small vascular damage, immediately they will bleed. So this is the most important different thing in the other shock and the septic shock. So septic shock has the component of bleeding. Okay, so now coming to the cardiogenic shock, it is due to the failure of cardiac pump, that is reduced cardiac output. Hypovolemic shock due to the reduction in the blood volume. Septic shock due to, at least you should know, endothelial activation and injury that leads to, very important, disseminated intravascular coagulation, which means disseminated means spreading, intravascular means inside the blood vessel, they are forming clot. So that is called DIC, disseminated intravascular coagulation, that will produce decreased platelet, decreased clotting factor, leads to bleeding. Leads to bleeding. This is the last slide. So shock produces widespread endothelial injury and disseminated intravascular coagulation, and they leads to bleeding. Shock means here septic shock. It is septic shock. Okay, so it all ends up with bleeding. Results in bleeding. Yeah. Okay, so this ends the lecture.